Remember, I think the number one thing with influenza we're finding is that really it's supportive care that's the number one treatment for this, because there's a couple of realities if you've come into the office to be checked for this. If we ended up doing a swab for influenza or H1N1 to set it to the state, it's about 3 to 4 days to even come back. So the reality is you're not going to know about the result truly by the time you get it back, you're going to be well anyway. So the best medicine is just rest, drink fluids, get plenty of sleep, take care of your own temperature, make sure that the Motrin, the Tylenol, make sure if you have any underlying conditions, you're taking care of them, taking all your medicines as prescribed, etc. I should keep my child home when he or she appears ill or is abnormally pale, less active, has a temperature over 100.4, that's the key here, by mouth, has a cough or is sneezing, complains of pain in the ears, throat, head, or chest, has thrown up in the last 12 hours, or has had two or more episodes of diarrhea in the past 24 hours. A couple caveats about kids, though. Unfortunately, because of their immune system, they tend to react to the influenza a little bit slower than we would. So they could be shedding the virus for longer than adults could. In adults, we don't quite know what the contagious period is, but as a rule, we say 24 hours past the last fever, excuse me. But the reality is they may be contagious up to 7 days. So anyone with an immune system, say they're on prednisone, they may be a bad diabetic, they're on chemotherapy, something that causes their immune system to be less aggressive, they may be spreading that virus and unable to get rid of it for up to 7+ days. In children as well. So a good rule, the 24 hours after a fever is a good rule, except you also remember that kids may not have a fever as well. So, and the other consideration about children is, as you look in this list, it is a whole heck of a lot of things that are non-influenza, including urinary tract infections, pneumonias, significant ear infections, strep throat, et cetera, et cetera. So you got to take this with a grain of salt that if you're not getting any better, it may not be influenza, it may be something else we're dealing with. Caregivers can do the following. Certainly separating the ill from the well. That's the best way to it's called herd immunity. As we all start getting vaccinations, we start getting the influenza, those of us who have been affected by the disease start to protect the rest of us who have not. And part of that herd immunity is those who are ill are not exposed to those who are well, and so we prevent the spread of this disease. Again, we are giving out Tamiflu, which is the medication for influenza, but the reality is the vast majority of us don't need it. We simply just need to stay home, stay away from those who are well. Designate one person as the main caregiver. I think down the road, those are the people who are the healthiest, who maybe have had the flu already or the flu shots, those are the ones really who should be the designated caregivers, because they have the best chance of not becoming actively infected or seriously ill from the disease. Some medical conditions are considered high risk. Pregnancy is high on the list. So of the ladies who have contracted H1N1 when they were pregnant, there's been a handful of them actually died from pneumonia or pneumonia type processes, but also a lot of them, or a fair number of them, actually have had second or third trimester spontaneous abortions, unfortunately. So, which is a real big deal. I mean, it's the worst of the worst. So clearly, if you're sick, you think you have the flu, do not be visiting your pregnant neighbor. I mean, it's a real disservice to her. Diabetes, particularly if it's severe, heart problems, heart conditions, if particularly little children who have maybe some congenital heart defects. The suppressed immune system. We don't have a big HIV community here in Greene County, but certainly if you have HIV, if you have had a kidney transplant, if you're on steroids, if you're on medications for your rheumatoid arthritis or your psoriasis, and we all see the commercials for some of those. Those are clearly keep your immune system at bay, so it's going to be far more difficult to fight off this disease. Any kind of lung disease that's severe, emphysema, asthma, little children, cystic fibrosis. We don't see a lot of tuberculosis, but certainly if you have active tuberculosis, you should not be, you got bigger things to worry about, but certainly should avoid the flu. Chronic bronchitis. So if you look at the bigger population, a fair number of older folks have the chronic lung disease. We got kids with the asthma. So that's a big problem because pneumonia seems to be the biggest killer in the H1N1 pandemic currently, and over age 65. There's a caveat that over age 65, what we're finding is actually the swine flu is not new. It may have hit the big leagues, so to speak, but the reality is it's a mix of about 4 different influenza particles, one of them from swine, one from avian, or actually 2 from swine, 1 from human, 1 from avian, and actually was first isolated back in the 60s and 70s. So those of us over 60 who've maybe been exposed to the swine flu back in the day are actually doing better statistically than they would than regular influenza. So we're seeing people who are seemingly healthy and young dying from this disease because they've not had the same exposure. So we think those who may have been exposed to one of the previous epidemics of swine flu back in the day actually they've gained a little bit of protection against this new pandemic.